Hello, it's Dr. Carin here. I hope you're doing well today. I feel like I haven't been on here for a while, but it's good to be back. Thanks for joining me. So today I wanted to give you 5 signs of stress causing hormone imbalance. But before I get into that, just with our schedules changing and probably your schedules changing too, we wanted to make it easy for you to make sure that you can watch our lives. One way you can do that is you can follow us on Facebook and you'll get a notification as soon as we go live. But to get notification ahead of time, click the link in the description to get our schedule and our video notes directly to your inbox. So that's in the video description right now. So today it is June 29th. Happy summer. I hope your summer is starting out well. So 5 signs that stress is causing your hormone imbalance. So we've been talking about stress these last few weeks. Have you picked up any tips or tricks, ideas, things that you've been trying out to help with your stress? Drop them in the comments now. I'd love to see what you've been working on. Hot and cold showers maybe, meditation. I'd love to know what you've been working on. One of the definitions of stress that I really like is by Hans Selye. He's actually the guy that actually coined the term stress that we now use on an everyday life. But he defines stress as the non-specific response of the body to any demand for change. And I really like this because the stress response, it's not always dangerous or destructive. It's not something that we need to fear or that we need to avoid stress at all times. In fact, stress can actually be an important part of growth and development. For example, exercise creates a temporary activation of that stress system. And over time, that actually helps us to get stronger and more resilient. And you've heard of cortisol, that stress hormone. Recently, it's been a little bit demonized that it's a really bad hormone that we have to get rid of, and it's certainly not the case. We need it as a part of our healthy hormones. Cortisol is what helps to wake us up in the morning, for example. Gives us that little bit of energy in the morning to wake up easily. So what we do see is, or when we do run into problems, is that chronic stress. And that's something that we've been talking about over the last few weeks. So these are the stresses where it's not a lion chasing you for a few seconds. These are worrying about money or thinking about what somebody said to us earlier, maybe last week or even last year. The pressure of social obligations, those kinds of things are stressors that are on our mind, could be for hours or days or even weeks, even years sometimes. And these kinds of chronic stressors can really affect our hormones. Women's health is a major part of my practice. And at the root of so many of these hormone imbalances, I see chronic stress as a really important component. And the problem here is that we often don't recognize stress as being an important issue until there's hormone imbalance. So that's why I really wanted to talk about this topic today, because sometimes hormone imbalances help us give us a first signal that there's something we need to do about our stress levels, especially chronic stress. So the question for me is not so much, do you have stress, but rather, how is stress affecting you? Now, there's even more difficult stressors that we have to deal with in our modern age as well. These are chronic inflammatory type of stresses. So this could be the accumulation of environmental toxins in our body. It could be what I like to call the chronic jet lag, which is when we have our awake and sleep timing that's separate from nature's day and night timing. And that could be because you're working night shifts or you're studying late at night. That can really affect inflammation levels in our body. Even just sitting at a desk for hours a day is hard on the body and can create that chronic inflammation. And the reason cortisol is secreted in response to this kind of inflammation is because cortisol is actually anti-inflammatory in the short term. this is our body helping to protect us from this inflammation. So it's a very loving thing that the body is doing for us, trying to give us this cortisol, reduce that inflammation. But of course, what if that inflammation is there for a longer time and the cortisol continues to get secreted, and that high cortisol levels are there for a long time, over time, that cortisol is also suppressing the not immediately essential systems, as in the systems that we don't need to run away from a lion. So these are systems like the digestive system, or the hormone system, our reproductive system, as well as the systems that help us with long-term energy production. So that's when we can start to run into problems. So how can you tell if stress is causing hormone imbalances for you? Okay, these are the 5 things that I would look out for. Number 1, it's poor blood sugar control. Now, this can show up in a couple different ways depending on what other things are going on in your body, especially insulin function. So, for example, stress can reduce insulin secretion. Insulin is what puts the brakes on as your blood sugar starts to rise after you've eaten. Insulin puts the brakes on that rise so that it doesn't get too high too fast. Stress can actually stop that insulin secretion, so your blood sugar ends up getting higher. My patients who have diabetes and are checking their blood glucose regularly have often seen this link between stress and blood sugar being higher blood glucose readings. Now, you can get low blood sugar as well with chronic stress. Do you tend to get lightheaded, sweaty, shaky, headaches, hangry 2 or 3 hours after you've eaten? Do you tend to carry a granola bar around just in case, because of these kinds of reactions that can occur? This is low blood sugar, hypoglycemia. And in some of these severe cases, it can actually happen because of the combination between 2 different things: high insulin, which can come from potentially chronic intake of lots of sugar or carbohydrates, and the chronic stress and its effect on your adrenal system. Both of those together can actually end up allowing that low blood sugar after you've eaten, a couple hours after you've eaten, get too low, and our body is unable to get that back up into balance. So a chronic stress can be a really important part of blood sugar health, as well as insulin. So it's not just about how much sugar you're eating or how much carbohydrates is in your diet when it comes to blood sugar balance. Okay, number 2, another sign that stress is causing hormone imbalance is difficulty losing weight. Excess cortisol can do a number of different things. One of them is that it shifts your metabolism to storing more fat, especially in our not so favorite abdominal area. On top of that, excess cortisol can actually change our appetite and can change our cravings to want more sugar, and then actually prevent our body's ability to signal to our brain that we're full. So multiple different things adding up to making it more difficult to lose weight when there's excess cortisol. Okay, number 3, period or fertility problems. So problems with the cycle. Now, when we're stressed, our body activates a fight or flight system so that we can run or fight. And that suppresses our systems like our reproductive hormones. In the long term, that will actually suppress our hormones across the board, really. Estrogen, progesterone, testosterone. So across the board, that means many different hormone systems are going to be reduced in our function. So that could prevent ovulation, we can have lower libido, it can even affect sperm count. One of the things that I see oftentimes is low progesterone. And this is coming from the high demand for cortisol, for stress hormone. The cortisol can actually steal the ingredients our body needs to to make more progesterone. So over time, this leads to things like PMS symptoms, heavy periods, and difficulty conceiving. Another hormone imbalance that we can see are hot flashes. So believe it or not, we can actually experience hot flashes even before menopause. So this is because starting in perimenopause, our hormone levels from the ovaries are gradually and naturally declining. And this is switching to relying more and more on the reproductive hormones from our adrenal glands. So that's estrogen, progesterone, testosterone from our adrenal glands, which is also the gland making cortisol and adrenaline. If chronic stress has already been taxing our adrenal glands for years before this transition from ovarian hormones to adrenal hormones can be even harsher and more imbalanced. And that's where we can see a lot of those typical symptoms of menopause, like hot flashes. So around this time, perimenopause and menopause, self-care is such an important part, particularly stress management, a really important part of health in general. Does that make sense so far? Let me know if you have any questions or you've seen any of these imbalances already in your life or in your friends' symptoms and in their lives. Now, the last sign of stress causing hormone issues is thyroid imbalance. So as I mentioned earlier, cortisol is anti-inflammatory, so it actually suppresses inflammation, which is a great thing in the short term. But in the long term, suppressing inflammation means suppressing the repair of tissue. So that means that in the long term, you can actually start to get a destruction of tissue, which, as you know, is not a good thing in the long term. We call this catabolism in the body. Now, our body is always looking to protect us, and when we sense that there is more destruction of tissue, our body will protect us by slowing down our thyroid. And that helps to slow down the rate of destruction of tissue. However, as you know, slowing down our thyroid also means slowing down our metabolism. So we can end up gaining more weight, holding on to weight, also having cold intolerance, fatigue issues, constipation, indigestion, hair loss, and a lot of these other complications. So unfortunately, from chronic stress, you can have hormone imbalances that make us feel even more overwhelmed and more uncomfortable. And these hormone imbalances can continue to get worse, going from minor blood sugar issues to higher risk of diabetes or difficulty losing weight to obesity and more hormone complications with cycles and menopause and thyroid function. But if we can break that chronic stress cycle, multiple body systems can rebalance and repair itself. So where do we start? That's always the question. Now, my favorite tip here is gratitude daily. Practicing gratitude every day. Just take 2 minutes out of your day. Write down 1 to 3 things that you're grateful for. They could be tiny little things. They could be big things. They could be just a smile that you saw on somebody's face. It could be a beautiful flower that you saw on somebody else's balcony garden. It could be small, it could be large. Write that down, but make it a habit to do that every day. When we write that down, that gratitude practice communicates to ourselves, to our nervous system, that we're safe and that there's abundance in our life. That immediately winds down our stress systems and actually activates the other system we haven't talked about that much today, which is that rest and digest system. And that's the system that can actually rebalance and repair our hormones. That's a system that we activate when we do acupuncture, for example. And we can do that with regular gratitude practice. We also have lots of other great ideas like hot and cold showers, meditation, breathing exercises. Look back on some of our videos from the last few weeks for some really great tips and tricks on how to break that chronic stress cycle. If you have friends who have hormone imbalances, please share this video with them so that they can help to break that stress cycle and improve their hormone imbalance as well. To the Canadian viewers, have a wonderful Canada Day in the next couple days. To our American friends, I will be back here on Saturday, July 4th, to do a deep dive on unexpected causes of headaches and migraines. So please join me for that. If you have any questions about this video or about this topic on stress and hormones, do drop them in the comments. I'd love to hear from you. Thanks for joining me today, and I will see you next time. Have a great day. Bye.